Dr. Saliman gave me hope that I could continue with activity and function without having to do a full knee replacement. So I would tell anybody that's facing that kind of diagnosis that they need to consult with Dr. Saliman. Don't let some doctor go in and remove the meniscus and tell you these things that you need full knee replacement when there's alternatives. And the Misha knee system, I was impressed that to me, it's less invasive. No cutting bones as far as like a full knee replacement, that sort of thing. And so that was what I was looking for. I didn't want someone coming in and cutting in my bones, and I'm not 80 yet. So I still hope to have 20 more years of activity. So people that are getting older shouldn't give up their mobility and without checking into this type of technology nowadays. And I wouldn't be active now if it was a full knee replacement. And I'm only going on to 4 months post-surgery. And I'm walking stairs. I'm actually working. I'm back active with my dogs. I can go upstairs. Going down still a little bit of a challenge because of the meniscus is still healing. But that will come. And I can go down a ramp, walk down a ramp without anything hurting. Like I said, my husband's impressed that I can work and function as much as I'm doing with no pain. He just thinks that's awesome. And I do too. So Dr. Saliman really helped put all of that back together. And I couldn't ask for a better doctor.